Versed, also known as midazolam, is a central nervous system depressant medication often utilized in the emergency room setting for various purposes, such as procedural sedation and rapid sequence intubation, which is a procedure that quickly secures the airway in patients with critical illness or injury. 1. Procedural sedation in adults. The initial intravenous dose for adults is typically 1 to 2.5 mg. The effectiveness of this dose will depend on the patient's reaction, and if the desired level of sedation is not achieved, the dose can be repeated every 2 to 3 minutes until the desired effect is achieved. 2. Rapid sequence intubation in adults. Versed is often administered intravenously at a dose of 0.3 to 0.6 mg per kilogram of the patient's body weight. The typical doses for this usage generally range from 5 mg to 20 mg. 3. Acute agitation in adults. For the treatment of acute agitation, an initial dose of 5 mg can be given intramuscularly. Depending on the patient's response, this dose may need to be repeated every 15 to 20 minutes until the desired level of calm or sedation is attained. When it comes to adjusting doses of Versed, close monitoring of the patient's vital signs and level of sedation is necessary. If a patient is not sedated to a desirable level with the initial dose, additional doses may be administered cautiously. However, it's crucial to avoid oversedation, as this can lead to problems such as respiratory depression and a decrease in blood pressure and heart rate. In older adults, reduced dosages are typically recommended due to an increased sensitivity to the medication, potential interactions with other medications, and the presence of other illnesses or conditions. As always, these guidelines may vary depending on the patient's individual clinical scenario and the specific guidelines of the healthcare institution.